Hello, everybody. My name is Willie Martinez. I am a licensed insurance agent. I also have received training and certification from the federal government's website on healthcare reform. And today, you can review all these facts by going to the government website if you want to get more information, more details, which is on www.healthcare.gov. Okay, let's get started. Now, essential benefits must include services within the following 10 categories, and this is something new during the healthcare reform that got initiated in 2014. Every major medical insurance carrier and all the federal exchange plans have to include at least these 10 minimum essential benefits. Now, the federal government, if you're going to go through the federal exchange plans, and if you think you may qualify for tax subsidies or reduction of deductibles and copays, then this may be the way you may want to go on the federal government website. Now, there is a fifth plan that's for catastrophic reasons, but we're only going to talk about the four most common plans for the federal exchange, which is bronze, silver, gold, and platinum. The bronze has 60% coverage, the silver 70%, gold 80%, and platinum 90%. Most Americans will probably not be able to afford number three and four, depending on your eligibility and what you qualify for. And most Americans will probably choose one or two because that'll be the most affordable. The only challenge there is the out of pocket, but we'll talk about that further. Now, there are websites that will give you more information, like CoverageCA.com. So, hard to see this, but so we'll just blow it up a little bit. And here's bronze and silver. This is the actual plans from the federal exchange plans. The bronze has a $5,000 medical deductible and drugs. Now, you will have options to choose from. This is just the basic information. So, this could change depending on what you choose and what you're eligible for. And you can see the silver has a $2,000 deductible. But both plans will have about a $6,350 maximum out of pocket for one and $12,700 for a family. And again, depending on your options, once you go online, you can play around with this. And depending on your eligibility, you may have qualified for tax subsidies and reductions on deductibles and copays. Again, the federal poverty guidelines will let you know what you're eligible for, whether you have a household size of one or more. 133% or below the federal poverty level will automatically get you referred to the local Medicaid office. It doesn't mean that you'll actually qualify. They'll just refer you there. You still have to answer some more questions to see if you're eligible. If you're over 133% but below 250%, then you may be eligible for not only tax subsidies or money, but to help you pay for the premiums, and you may be eligible for reductions in your deductibles and copays. And as long as you're below 400%, you should be eligible for tax subsidies. Okay. Now, the tax credit, how's it going to help you? This is an example from the actual healthcare.gov website for three different size households, four, and one, different annual incomes, different yearly costs of major medical. This is just an average, an example, and the example of the yearly federal government subsidies. This money will not be coming to you. It will go to the insurance carriers. You'll pay the difference. So it could be substantial depending on your annual household income. It could be just a little bit, but if you qualify for something, something is better than nothing, as they say. And of course, you also want to see what you may be eligible for on tax penalties, where if you don't buy anything, there is a tax penalty the first year of $95 or 1% of your income, and that's per year, whichever is greater. So if you're earning $30,000 a year in income or household income, that's $300 per adult, tax penalty. In 2016, if you don't have health insurance, the fine increases to $695 and $347.50 per child, up to $2,085 per family, or 2.5% of your income, whichever is greater, if you still don't have health insurance by 2016. Now, for companies, they're looking at penalties as well for if they have 50 or more full-time employees. Now, this goes into effect in 2015 for companies with 50 or more full-time employees. The employer faces a $2,000 fine per full-time employee after the first 30 full-time employees if health insurance is not provided to at least 95% of all full-time employees. And every two part-time employees count as one full-time employee. So those big restaurant chains, they're going to be really highly affected by this. Employees cannot pay more than 9.5% of their salary towards coverage, or employers will pay a $3,000 fine per employee. And multiple tax locations with separate tax ID numbers will count as one employer if it's the same owner. Again, you can go to www.healthcare.gov to get more details. Thank you. Have a great day, and God bless.